Minister.
Mr. Chairman, since independence, Singapore has charted through several crises, adapted to the changing world, while strengthening our social compact to keep our society strong. Many members of this House have shared how COVID-19 has accelerated change and uncertainties. As we recover, we must continue to renew our social compact, enabling our people to be resilient in overcoming future challenges. Our healthcare system is a critical part of our social compact. We will continue to transform it to become a proactive and inclusive care system for all Singaporeans, enabling them to attain good health and live well. We will build resilience in every individual throughout life, designing our care system to address Singapore's health needs and risks across the life course. Today, I will highlight how we are doing this at two ends of the spectrum. First, starting well in life, and second, aging well. For our young, we need to help them start well and achieve their fullest potential. International research shows that the early years of life are a critical window for development, with lasting impact on later life outcomes. This extends to even before the child is born, during the antenatal stage. Locally, the Growing Up in Singapore Towards Healthy Outcomes, or GUSTO, found several evidence that a mother's health can directly influence her child's development, which Ms. Ng Ling Ling spoke about. These findings underscore the importance of intervening early in life to prevent disadvantages from snowballing, and that parents play a key role for a child's long-term development. Mr. Leon Pereira will be happy to know that it was to this end that the government launched and is scaling up Kids-Start to give children from low-income families a good start in life through upstream support. We equip Kids-Start parents with skills and knowledge to support their child's development, physical and social, emotional well-being. At our hospitals, the National University Hospital started an intervention program called PROPEL, promoting parental emotional health to enhance child learning, PROPEL. It supports mothers and mothers-to-be from low-income families through pregnancy into motherhood to enhance the child's development and learning. Ms. Nurdiana joined the program during the early stages of her pregnancy. She struggled with anxiety after being diagnosed with an autoimmune disease and had lost her job. The PROPEL team provided psychological interventions, helping her work through her fears and anxiety on health, pregnancy, and motherhood. With the support, Ms. Nurdiana developed skills to better manage her stress and anxiety. She's now more confident to start her journey as a mother. The National Healthcare Group is partnering with a few primary schools on the Living Well at School pilots. It aims to build awareness and motivation in choosing healthier food options for the young. Children are coached on healthier eating choices, while parents and teachers are equipped with resources to scaffold the child's journey to embrace healthy living. While we have made good strides in promoting the health and well-being of children and their families upstream, we will continue to invest even more so that we can have a healthier next generation. We must do so in a coordinated manner across social, health, and education boundaries. Therefore, I'm pleased to announce that MOH will develop a child and maternal health and well-being strategy to provide comprehensive support to women and their children. We will drive the strategy and action plan through an interagency task force over a 5-year period. Its scope will span from pre-conception to the adolescents aged 18 years old. Many critical development milestones occur then. These are part of our larger efforts to improve the population's health by addressing individual health needs and modifiable risk factors beyond the healthcare domain. The task force will focus on cross-cutting issues that require multiple agencies to collaborate and address decisively to achieve a common goal of better health, social, and education outcomes for our young. We will review our service delivery processes to integrate our services better across the domain. Our plans will be anchored on what matters most to mothers and their children. Since early this year, the task force has already started engaging various groups of parents and stakeholders to better understand their challenges in fostering a healthy lifestyle in their children and in accessing services. We found their feedback very insightful and will continue to facilitate more conversations throughout the year. Next, on the second group, our seniors. While COVID-19 has posed many challenges, it also presents us with new opportunities to further transform our support for them. In this spirit, we have embarked on a refresh of the Action Plan for Successful Aging, a refresh on the Action Plan for Successful Aging. Since its launch in 2015, we have made significant progress on many fronts. We've raised the retirement age, provided seniors with opportunities to learn and volunteer, and rolled out the Pioneer and Merdeka generation packages. Nevertheless, our plans must continue to evolve to meet the needs and aspirations of current and future generations. Achieving these aspirations is only possible through a whole-of-society, citizen-centric effort that brings together everyone to turn silver into gold. In my previous job, I was turning waste into wealth. This time, I'm trying to turn silver into gold. I'm glad to share with Mr. Yip Hong Wing that we have started engagement sessions since last October to partner citizens on the Refresh Action Plan. I encourage everyone to join this meaningful national SG Together effort. Having participated in some sessions myself, I'm deeply encouraged by the diverse discussions and participants' aspirations to age well. Beyond this, Mr. Tan Wu Ming and other members have also asked about our ongoing efforts to enhance support for seniors. I would like to share about 3 areas. First, our care landscape. Second, caregiver support. And third, developing the community care sector. Our care landscape. In our care landscape, we launched the new community care apartments in Bukit Batok last month, a novel public housing cum care concept. The flats integrate senior-friendly housing features with care services and community building through social interaction and communal spaces. When I visited the exhibition at HDB Hub, a senior told me that she had been long awaiting this. Others said they appreciated the communal spirit that it brings, greater assurance to age independently, and a range of programs to keep them active. The flats were oversubscribed, with more than 4 seniors applying for each flat. We'll continue to work with MND on planning for additional sites. Last December, we announced a new elder care center service to serve all seniors nationwide. These centers would be keynotes in our social support and care landscape, and the first batch of centers will start from 1st May 2021. MOH will set aside about $180 million to complete the rollout of over 200 centers by 2024. Each will provide a common suite of ABC services. A for active aging programs, B for befriending, and C, connecting to care services. Seniors can participate in wellness activities or have their queries about care services and support schemes answered. Befrienders will reach out to those with little support. To better reflect the new model, centers that provide the suite of ABC services will be named Active Aging Centers. Today, some centers provide care services, such as daycare and community rehabilitation. They will be called active aging care hubs once they come on board to provide the new AVC services on top of their existing regular care services. Next, on caregivers. They play a key role in supporting seniors to age well in the community. To support them better, MOH launched the Caregiver Support Action Plan, or CSAP, 2 years ago. In response to Ms. Yo Wan Ling and Mr. Yip, I'm pleased to share that MOH, AIC, and various community partners have rolled out all the initiatives under the CSAP. I will share a couple of examples. First, we launched the Home Caregiving Grant 2 years ago, providing a cash grant to help with caregiving costs. More than 29,000 caregivers have since benefited. To Mr. Yip Hong Weng's query, we are also reviewing the Seniors Mobility and Enabling Fund to further defray costs of caregiving. Second, we set up touchpoints within the community to support seniors and their caregivers. For example, the Silver Generation Office refers frail and homebound seniors to the medical escort and transport service to assist them in getting to their medical appointments. Third, we also have various caregiver respite services. We introduced the home-based respite care pilot in September 2019 for palliative cancer patients and expanded this in 2021 to all patients receiving home palliative care, regardless of diagnosis. Fourth, we will be launching a new grant called this year on the caregiving ecosystem under the National Innovation Challenge on Active and Confident Aging to support research on innovative solutions to sustainable caregiving. Fifth, we have worked with community partners to set up 4 caregiver community outreach teams to better support caregivers at risk of burnout or developing mental health needs. We will increase this to 6 teams by year-end. We have also established 7 caregiver support networks in dementia-friendly communities, enabling peer support among caregivers. In addition, we'll pilot a structured support system for caregivers of loved ones first diagnosed with dementia. We will proactively support and equip these persons with dementia and their caregivers with information upon the first diagnosis. I will also share more on the support measures we have for caregivers of persons with disabilities in my MSF COS speech. Finally, developing our community care sector to better serve seniors' needs. We have expanded the capacity of community care services. Since 2015, we have added 4,600 day care places as well as 3,100 home care places for homebound seniors. We have also added 4,000 nursing home beds to cater to frail seniors with less family support. We share Mr. Ang Wei Neng's concern about the impact of COVID-19 on the construction of nursing homes. To mitigate this, we are working with providers to open up currently non-operational beds. AIC also helps seniors and caregivers with alternative care arrangements while awaiting nursing home placements, such as the interim caregiver service for short-term home-based custodial care and the integrated home and day care program. Seniors or caregivers who need help can approach AIC for further assistance. Before I conclude, let me summarize my speech in Malay. Sistem penjagaan kesihatan amat penting untuk membina sistem sokongan sosial yang padu. Kami akan terus memperbaikinya untuk memberikan penjagaan kesihatan yang proaktif dan inklusif untuk semua warga Singapura. Kami akan melakarkan strategi kesihatan dan kesejahteraan kanak-kanak dan ibu yang meliputi 5 tahun. Plan ini akan memberikan sokongan menyeluruh kepada kaum ibu dan anak-anak kecil mereka pada fasa-fasa hidup yang penting untuk menghasilkan perkembangan kesihatan, sosial dan pendidikan yang lebih baik untuk generasi akan datang. Untuk warga emas, kami akan bekerjasama dengan agensi-agensi dan individu dari pelbagai latar belakang untuk sama-sama memiliki dan menjayakan inisiatif-inisiatif baru melalui pembaharuan Pelan Tindakan Penuaan Berjaya. In closing, Chairman, we are in good state to address the future's challenges by identifying points of intervention upstream and strengthening support in the community. These are part of our continuous efforts to renew our social compact, to safeguard our future as a strong, resilient, and caring society. Thank you.